Hi, my name is Christine Mulligan, and I'm a student at Purdue University Calumet, and today I will talk to you about hearing aids. So what is a hearing aid? A hearing aid is a small electronic device that is worn either inside the ear canal or worn just outside the ear. Hearing aids amplify sound so that a person with hearing loss can use the device to hear better and communicate more effectively. As explained by the Food and Drug Administration, or the FDA, most hearing aids share several similar electronic components, including a microphone that picks up sound, an amplifier that makes the sound louder, a miniature loudspeaker or receiver that delivers the amplified sound into the ear canal, and batteries that power the electronic parts. The FDA also states hearing aids differ by design, technology used to achieve amplification, which would be analog versus digital hearing aids, and the special features that are offered. Some hearing aids also have ear molds or earpieces to direct the flow of sound into the ear and enhance sound quality. The selection of hearing aids is based on the type and severity of hearing loss, listening needs, and lifestyle. Hearing aids are the most commonly used hearing device on the market today. It's no wonder there are several styles and devices on the market available. According to the National Institute on Deafness and Other Communication Disorders, a hearing aid has three basic parts: a microphone, amplifier, and speaker. The hearing aid receives sound through a microphone, which converts the sound waves to electrical signals and sends them to an amplifier. The amplifier increases the power of the signals and sends them to the ear through a speaker. As explained by the FDA's government website, there are different types of hearing aids on the market today that differ in make and efficiency of sound amplification. Behind-the-ear hearing aids contain the majority of their parts outside the ear. The mechanical parts are contained in a small plastic case that rests on the back of the ear. The case connects to a small plastic tube, which then connects to an ear mold. These hearing aids are very common, and they are sturdy and easy to clean. The next type is mini behind-the-ear hearing aids, which are very similar in style to the typical behind-the-ear hearing aids, except that they are smaller and thinner. These hearing aids are more easily hidden and are more cosmetically pleasing than normal behind-the-ear hearing devices. Another type of hearing aid would be in the ear and in the canal hearing aids. These are devices that are worn within the ear or within the ear canal that contain all the components in a very small plastic casing that fits inside the ear. Though they are easily hidden and cosmetically pleasing, the small size makes them hard for some people to adjust to. They are also not as strong with amplifying sound as other devices are. The different types of hearing aids differ in efficiency as well as the shape and aesthetics of the device. A person with hearing loss must choose a hearing aid style based on lifestyle and severity of their hearing loss. Aside from the usual digital or analog hearing aids, there is another type that is perhaps more advanced in technology that requires surgery to implant the permanent device. This hearing aid is called a cochlear implant. Cochlear implants do not simply amplify sound like many hearing aids do. Instead, cochlear implants send sound signals to the nerve to stimulate hearing. As stated by JohnsHopkinsMedicine.org, sound energy is used to directly excite the nerve of hearing. Electrical contacts placed within the cochlea send signals to the hearing nerve. These signals form a code based in those features of speech that are critical to word understanding in normal listeners. Either through a process of learning in the early formative years or by virtue of hearing memory, the brain is capable of interpreting this code to enable speech and appreciation of the surrounding soundscape. Though the technology is advanced and many deaf patients benefit from cochlear implants, the devices are not foolproof. Not everyone can benefit from the implants, and the high cost as well as the daunting surgery requirement can hinder some from trying cochlear implants. In conclusion, hearing aids are perhaps the most commonly used device to help amplify sound for the hearing impaired. Hearing aids differ in style, efficiency, and some are permanently implanted by surgery. Though many kinds of hearing aids are available on the market today, the technology is not a cure-all to deafness, and often help from these devices can fall short for individuals who suffer severe hearing loss. My hope is that with better technology being developed and with new advances in medical science, one day soon the market will offer greater devices as a better solution for the hearing impaired. Thank you again for your time and support.